Right now, I mean, millions of people are walking around wearing these highly engineered active chemical environments that are basically disguised as everyday underwear.
Yeah. And it's wild because almost no one realizes what's actually happening inside them.
Exactly. And, it gets worse. A lot of folks are using a daily routine of just standard soap and water on a leak, which is actually destroying their skin's first line of defense.
it's it's doing the exact opposite of what they intend, honestly.
Right. So welcome to this deep dive. Today, our mission for you is to really dig into a massive stack of medical guidelines, product catalogs, and nursing journals.
There's a lot of material to get through, yeah.
There really is. And we want to answer one highly specific question. What specialized protective garments or, absorbent underwear are truly the safest for chronic skin health when you're dealing with stress urinary incontinence?
And looking through the literature, the sheer volume of, well, material engineering dedicated to this single issue is just staggering.
It's like a whole hidden world of science, right?
It really is. It requires a complete shift in how we think about textiles, fluid dynamics, and even dermatology.
Well, since you already know the basic structural mechanics of SUI, the weakened pelvic floor, that sudden spike in intra-abdominal pressure from like a cough or a heavy lift, let's just bypass all the basics.
Yeah, I mean, we know what causes the leak. That's the
No.
easy part.
Right. So what jumped out at me immediately from these sources is how often people try to manage these pressure-driven leaks using standard period underwear,
Oh, yeah. That is incredibly common.
which is crazy because it completely ignores the actual physics of the fluid delivery.
It really is a massive mismatch in material purpose, because menstruation involves a high viscosity fluid absorbing at a relatively slow, localized rate over many hours.
It's kind of a slow drip, basically.
Exactly. But SUI, on the other hand, is characterized by rapid, low viscosity, high volume fluid surges.
So it's basically hitting the fabric all at once.
Right. And when a sudden downward pressure forces that fluid out, it can happen with significant mechanical force.
Okay, let's unpack this for a second. If you hit a standard cotton gusset in typical period underwear with a high volume surge, what actually happens to the fluid?
Well, you get what textile engineers call side pooling.
Side pooling.
Yeah, the liquid hits the fabric much faster than the surface tension can be broken and absorbed. So it immediately just rushes outward to the edges of the garment.
Because water takes the path of least resistance.
Exactly. And that path usually means leaking straight out of the leg gathers.
Oh, wow. Okay, that makes sense.
Dedicated incontinence underwear, though, is engineered with entirely different gusset materials to instantly break that surface tension. It's built specifically to handle those rapid surges.
That makes the engineering difference pretty clear.
Yeah.
But the core of our stack of research today isn't just about preventing wet clothes.
No, not at all. It's much more serious than that.
Right, it's about chronic skin health. I mean, if period underwear or a standard cotton pad fails, you get wet jeans. But if an SUI garment fails, you are dealing with a severe medical issue.
And this is exactly where incontinence-associated dermatitis, or IAD, enters the picture.
IAD. Okay, so how does that start?
Well, we all know the skin maintains an acid mantle, right? It's that slightly acidic microclimate hovering around a pH of 5.5, which acts as a barrier.
I like to think of your skin's acid mantle as this microscopic fortress wall.
That's a great way to picture it, yeah. The crisis with SUI is that urine is highly alkaline and it carries ammonia.
So it's basically the exact opposite of what the skin wants.
Exactly. When a high-volume surge pulls against the skin, you aren't just getting wet, you are essentially subjecting the skin to an aggressive chemical attack.
It's neutralizing that acid mantle on contact then. The alkaline urine is like a battering ram against that fortress wall.
Instantly. The alkaline urine rapidly raises the skin's pH, which effectively blasts the gates wide open.
Wow.
And once that barrier breaks, the biological mechanics get incredibly hostile. The warm, moist, alkaline environment triggers something called a dimorphic shift in fungi that already live on the skin.
Wait, a dimorphic shift? Fungi.
Yeah, like Candida albicans.
What does a dimorphic shift actually mean for the skin tissue, though?
It means the fungus literally physically changes shape.
You're kidding.
I'm not. In a healthy acidic environment, Candida exists as these harmless, round yeast cells. But when the pH spikes from that urine exposure, it transforms into its hyphal form.
High form, what is that?
It grows these long, branch-like filaments that literally burrow down into the epidermal layers of the skin.
Oh my God, that is genuinely horrifying.
It is, and that is what causes severe thrush. It presents as intense erythema, painful blistering, and even deep tissue loss.
So the fungus is basically weaponized by the pH shift.
That's exactly what's happening.
And here is a twist that absolutely blew my mind when I was reading through the nursing journals for this deep dive.
Oh, I think I know what you're going to say.
If a leak happens, I mean, the immediate instinct for almost any patient or caregiver is to just go clean the area with standard soap and water. Right?
Yeah.
Cleanliness is next to godliness.
It is a deeply ingrained habit for most of us. But clinical practice over the last decade has vehemently turned against it.
This is so wild to me.
Using standard soap and water on an SUI leak actually accelerates incontinence-associated dermatitis.
Okay, let me make sure I'm understanding this perfectly. You're telling me that if a caregiver uses, like, standard hygiene practices to clean a patient, they are actively making the chemical attack worse.
Yes, absolutely.
That goes against every basic instinct we have.
It does. But if we connect this to the bigger picture of the skin's chemistry, you have to realize that standard bar soaps and liquid body washes are highly alkaline.
Oh, right.
They often hit a pH of 9 or even 10.
And you already have alkaline urine compromising the barrier in the first place.
Precisely. By introducing alkaline soap, you are just compounding the chemical damage. Furthermore, the surfactants in commercial soap, the molecules that make it foam and lift grease, they do not discriminate.
They just strip everything.
Yeah, they aggressively strip away the essential intercellular lipids, the ceramides and fatty acids that actually hold your skin cells together.
So you were basically washing away the mortar between the bricks.
That's a perfect analogy. You leave the skin highly permeable, incredibly fragile, and just completely defenseless against the friction of the clothing itself.
I mean, if washing the skin with soap is essentially destroying the fortress wall, then the burden of protection falls almost entirely on the garment.
It really does.
And I think most people assume incontinence underwear is just, a thicker version of a sanitary pad, just some passive sponge.
But the reality couldn't be further from a passive sponge, actually.
Right, because of all the engineering.
The material science hidden inside modern disposable garments is just staggering. Let's look at the anatomy of a high-tech disposable incontinence garment, pulling from those clinical trials in our sources.
Okay, let's break it down.
The first critical defense mechanism is the ADL, which stands for the acquisition distribution layer.
That's the layer just beneath the top sheet, right? The part that actually touches the skin.
Yes, exactly. It is constructed from these specialized, coarse polyester fibers, and its primary function is to manipulate capillary action.
Okay, so how does it handle the side pooling issue we talked about?
When that rapid SUI surge hits, the ADL prevents the side pooling because it uses relatively large interstitial cavities to instantly pull massive volumes of fluid downward.
So it forces away from the skin immediately.
Right. And then it aggressively channels it horizontally to spread it out across the entire surface area of the underlying core.
So it's acting as a high-speed traffic controller for the fluid.
Basically, yeah.
But spreading it out doesn't get rid of it. I mean, where does the liquid actually go once the ADL moves it?
It gets handed off to the real chemical marvels of the garment superabsorbent polymers, or SAPs.
SAPs. Okay, what are those exactly?
These are microscopic particles, typically cross-linked sodium polyacrylate, and they're dispersed all throughout a cellulose fluff inside the core.
And they just absorb the liquid.
Oh, they do way more than that. SAPs can absorb 20 to 50 times their own weight in salt-containing fluids, like urine.
Wait, 50 times their weight. That is an incredible metric.
It's massive.
But I have a mechanical question here.
Sure.
If I spill water on my kitchen counter and wipe it up with a regular sponge, the sponge holds the water, sure.
Mm-hmm.
But if I press down on that wet sponge, the water just squeezes right back out onto the counter.
Right, the pressure forces it out.
So why doesn't that happen when someone sits down in one of these garments? I mean, they're sitting on it with their full body weight.
Because it is an active chemical reaction, not just physical absorption.
Oh, interesting.
When the urine hits the SAPs, osmotic pressure takes over. The sodium ions inside the polymer matrix want to equalize with the fluid outside.
So they pull the fluid in.
Exactly. As the water rushes into the polymer, the molecular chains literally uncoil and expand. They trap the water molecules inside a massive three-dimensional gel network.
So it literally turns the liquid into a solid.
A dense hydrogel, yeah. Because the fluid is chemically bound within that polymer matrix, it physically cannot be squeezed back out.
That's amazing.
In textile engineering, this is called preventing re-wet. Even if the wearer shifts their weight, crosses their legs, or, sits down heavily, the moisture is locked away.
Okay, but here's where it gets really interesting, though.
Yeah.
The sources indicate that these garments aren't just managing the moisture. They're actually fighting the biological battle against that fungal shift you mentioned earlier.
Yes. What's fascinating here is how manufacturers have weaponized the core of the garment to actually maintain dermatology.
Weaponize the diaper, essentially.
Pretty much. Advanced products don't just absorb, they act as a chemical buffer. Brands like Molicare, for example, have integrated what they call skin guard technology.
And what does that do?
They disperse monosodium citrate directly into the absorbent core.
So they built a pH buffer right into the diaper itself. How does that activate?
Well, when the alkaline urine penetrates the core, the monosodium citrate dissolves. It immediately begins releasing protons to neutralize the hydroxide ions in the urine.
So it fights the alkalinity on contact?
Exactly. It actively forces the microclimate at the surface of the diaper to remain slightly acidic, right around that crucial 5.5 pH mark.
That is just incredible.
It artificially preserves the skin's natural acid mantle and even neutralizes the ammonia before it can evaporate, which, as a bonus, traps the odor.
So the underwear is actively doing the job of the skin's compromised immune system. It is absolute wizardry to me.
It's highly advanced chemistry for sure.
And knowing this level of active chemistry exists brings up a massive debate in the nursing journals we reviewed.
Ah, the reusable versus disposable debate.
Exactly. There is a huge push towards sustainable, reusable cotton underwear right now. And obviously, we all want to be eco-friendly.
Of course.
So how do we reconcile the environmental appeal of reusables with the high-tech medical necessity of disposables, especially when chronic skin health is the ultimate goal for you?
It is a nuanced debate, but the medical guidelines draw a very clear line based on the severity of the condition.
Okay, where's that line?
Well, reusable incontinence underwear has exceptional benefits. From an ecological standpoint, reducing landfill waste is critical.
Absolutely.
And from a material standpoint, natural fabrics like cotton offer unparalleled organic breathability. Plus, they lack the synthetic polymers that might irritate highly sensitive skin.
Which makes them perfect for specific use cases, right? Like the long tail of postpartum recovery.
Yes, exactly.
Because after those first 2 weeks when the heavy bleeding stops, but sudden, light stress incontinence is still a daily reality, a breathable cotton reusable makes total sense.
Precisely. For light leaks, or, individuals with specific synthetic contact allergies, reusables are excellent.
But what about for heavy, chronic issues?
When the condition transitions to chronic, high-volume SUI, the clinical math changes drastically. For maximum protection against IED, the Wound, Ostomy, and Continence Nurses Society, the WOCN issues very strict guidance.
What do they recommend?
They recommend disposable pull-ons featuring super absorbent polymer technology as their absolute first-line defense.
Is that strictly because a reusable cotton gusset can't chemically lock away the moisture like that SAP gel can?
It is the moisture locking, the pH buffering, and this is crucial, the advanced reduction of skin shear.
Skin shear. Okay, let's clarify that for a second. Because skin shear isn't just basic chafing, is it?
No, skin shear is far more destructive than surface friction. Friction is just rubbing on the top layer.
Like a mild blister.
Right. Shear, though, occurs when the outer layer of the epidermis actually sticks to a damp fabric, but the underlying tissues continue to move with the body's motion.
Oh, ouch.
Yeah, the mechanical force literally tears the structural bonds between the skin layers themselves.
That sounds incredibly painful.
It is, but because disposable SAP cores pull the wetness away instantly, the skin spends vastly less time in that sticky, damp, fragile state where shear can occur.
I look at it like comparing a highly comfortable, breathable cotton t-shirt to specialized, moisture-wicking athletic gear.
That's a good way to frame it.
If you are just going about a normal, low-impact day, the organic cotton t-shirt is perfect. But if you are going to run a marathon and sweat profusely, or in this case, experience a heavy, chronic SUI surge, the highly engineered athletic gear is the only thing that will prevent severe chafing and keep you dry.
That analogy holds up perfectly under clinical scrutiny. And this actually brings us to a major warning in the WOCN guidelines regarding caregiver practices.
Oh, the booster pads issue.
Yes. When a primary brief or pull-on begins to fail or leak during the night, The immediate instinct for many caregivers is to just stuff extra unbacked absorbent booster pads inside the garment.
I mean, logically, you'd think more padding equals more absorption, right? Why is that a red flag?
Because it completely sabotages the engineering we just spent all this time discussing.
Oh, so?
While adding random layers disrupts the anatomical fit, it creates massive bulk that increases physical pressure on the skin, and most importantly, it completely destroys the breathability of systems like Tenna's Confio Air.
Because you're blocking the microscopic vapor escape routes.
Exactly. You trap heat, you trap moisture, and you drastically increase the risk of pressure ulcers and IAD. The focus must always remain on finding a primary garment with proper containment and breathability, not creating some makeshift suffocating patchwork.
Okay, so we have the athletic gear on, we have the superabsorbent polymers locking the moisture into a gel, and the monosodium citrate fighting the pH battle.
The fortress is built.
Right. But the research is emphatic that the garment cannot work in isolation.
No, it can't.
The synergy of the skincare routine during the actual changing process is just as vital. So if soap and water are actively destroying the lipid barrier like we talked about, what is the clinical alternative?
Clinical protocols now mandate the use of gentle, no-rinse cleansers.
The rinse cleansers.
Yeah. These are formulated as emulsions, foams, or liquid sprays, and they rely heavily on humectants.
Humectants being ingredients that pull moisture into the skin rather than stripping it away.
Exactly. We are talking about ingredients like glycerin, lanolin, or cetylsterol alcohol.
So they don't foam up and strip the lipids.
No. When you apply a no-rinse foam, it emulsifies and lifts away the dirt, microorganisms, and those alkaline irritants so they can be gently wiped off.
But it leaves the good stuff behind.
Right. The humectants remain behind, ensuring that the skin's natural intercellular moisture isn't stripped. And most importantly, these cleansers are pH balanced to the skin, so they clean without aiding that alkaline attack we talked about.
Okay, so what does this all mean for the actual daily routine for you at home? You use the no-rinse humectant cleanser, the skin is clean and pH balanced. Do you just grab a thick protective barrier cream, slather it all over to waterproof the skin, and pull up the high-tech garment?
And this is perhaps the most dangerous trap in the entire body of literature we reviewed.
Really? Just putting on a barrier cream?
Yes. It is where well-meaning caregivers inadvertently ruin the entire system.
Okay, explain that because it sounds totally counterintuitive.
Well, yes, barrier creams are mandatory for chronic SUI. They act as a physical shield. You have dimethicone, which is a highly effective water-repellent silicone polymer.
Right.
You have zinc oxide formulations like calmoseptine. And the newest clinical trend is cyanoacrylates, which are these advanced solvent-free films that bond directly to the skin to create a transparent, breathable armor without being greasy.
Those sound incredibly effective. Where's the trap?
The danger lies entirely in application thickness.
Oh, applying too much.
Yes. These barriers must be applied incredibly thinly. The problem arises when someone takes a petroleum-based or heavy zinc-based cream and applies it like frosting on a cake.
If the cream is too thick, does it transfer onto the garment?
It transfers heavily, and when that thick, waterproof paste hits the inside of the incontinence underwear, it literally clogs the microscopic interstitial cavities of the acquisition distribution layer.
Oh, the ABL.
Yes. It coats those coarse polyester fibers in grease, completely blocking the fluid from ever reaching the superabsorbent polymers down in the core.
So you essentially waterproof the one thing you desperately need to absorb water.
Exactly. You sabotage the multi-million-dollar engineering of the diaper. The urine cannot penetrate the clogged ADL, so it just pools on top of the greasy fabric right against the patient's skin, trapped inside the garment.
That is a complete system failure.
It is. The golden rule of SUI management is cleanse with no-rinse humectants and apply barrier creams so transparently thin they are almost invisible, allowing the high-tech garment to actually do its job.
That mechanical knowledge completely shifts the perspective. I mean, managing SUI isn't just about catching leaks. It is an active chemical battle to protect the skin's acid mantle and prevent fungi from mutating.
It's high-stakes chemistry.
It really is. By combining SAP-powered pH-balancing disposable pull-ons with no-rinse humectant cleansers and micro-thin barrier creams, you aren't just reacting to a mess. You are creating a highly calibrated dynamic fortress around the skin.
Very well put.
Thank you. And thank you for joining us on this deep dive into the surprisingly complex world of material science, fluid dynamics, and skin health.
It's been great. And, if we look toward the horizon, the future of this field isn't just about absorbing moisture effectively. It's about anticipating it entirely.
What do you mean by anticipating it?
Well, there's a fascinating mention in our medical sources about the rise of advanced wetness sensing technology. Companies like Medline are already integrating systems like FitRight Connect directly into protective garments.
Wait, smart diapers.
Exactly.
Yeah.
We are rapidly entering an era of smart clothing where the fabric itself will digitally notify a wearer or a caregiver the exact millisecond and microclimate shifts.
That would eliminate the guesswork entirely.
Yes, it prevents prolonged moisture exposure before the acid mantle even registers a threat, which leaves us with a pretty profound question to think about.
Lay it on me.
As this smart clothing technology scales and becomes cheaper, how might it fundamentally change not just the physical dermatology, but the daily dignity and independence of aging populations worldwide?